Welcome. Welcome to Georgia Southern University, the Jiann-Ping College of Public Health, the Departments of Biostatistics, Epidemiology, and Environmental Health Sciences. Today, we are very honored to have Dr. Kelvin Tsoi, Associate Professor at the Chinese University of Hong Kong, to present to us a very interesting topic on the digital management for hypertension under COVID-19. So Dr. Tsoi is an expert in digital health, and he has been doing a lot of research in these areas for years. And so this is our honor today to have Dr. Tsoi speaking to us on this very interesting topic. Without further ado, I give the floor to Dr. Tsoi. Thank you.
Thank you very much. I think this is very good time to have a sharing because I also share a bit about our experience to doing a startup because entrepreneur is now a hit topic, and at the same time how we do the proper health with some support from the community, and at the same time now we are under COVID-19, so what we can do better for our community, and at the same time a lot of techniques that we learn from school in fact can apply to different part of the world. So that's why my title mainly from School of Public Health, Chinese University of Hong Kong. At the same time, I'm the founder and also director for a company called Deep Health. I will cover this a little bit more later. Today in this presentations, I will cover 5 areas, including what is digital health. And if you have got some backgrounds on the digital health, then you will think how we can apply for real situation, for real disease. I will put the hypertension in here as an example.
Sure.
Okay, and of course, hypertension is a huge problem in many cities, and we will share a community project, and at the same time, how we can through this community project to promote digital management. That means the digital health applications for hypertension. And at the same time, we have a lot of opportunities after COVID-19. So I hope you enjoy my sharing today covering this topic. First of all, what is digital health? Digital health, a lot of definitions, and this is I just copy from the website, including the Food and Health Bureau and American Medical Associations, Nature Medicines, Simmons and Simmons. This is a law firm because we are expecting that we will have more and more law issues or sue cases regarding how we using the digital health, regarding the privacy issue, etc. So a lot of people thinking how we should have a better definitions on digital health, and also of course Canada Health. And in overview of this kind of definitions, you can see that digital health seems belong to mobile health, health information technology, wearable device, telehealth, telemedicines, personalized medicines. And at the same time, in the American Medical Associations, it includes the interpretations of used clinical data and some measure of the care quality. And also similar, we also promote remote monitoring and apps. And this is quite tricky that in Nature Medicines, we are talking about a rationalizing the healthcare and well-being. So you can taste what is digital health, but in fact, it seems whether it is under the tree of a digital device or the cloud medicines. So because of this, we did some systematic review to understand more about digital health. But this is a little bit old, around 2 years ago already. Just search until August 20. This is around 2 years ago. Because around the day, we form a team to do the digital health, but we are not quite sure how we describe digital health at the moment. So we use a digital and connecting to different healthcare words, including hospital, caring, intervention, treatment, therapy. We find that this is quite an interesting story. Around 5 years ago, we have more and more paper published related to the mHealth. mHealth means the mobile health and apps, how we use an apps monitoring the blood sugars level. Telemedicines correlate with the remote monitoring. A lot of people using electronic health record, how we apply the mathematical technique, the AI model, and at the same time, more and more the papers talk about the wearables like this. And when you see this trend, you can see that top 4 is increasing over the past few years. In fact, I think if we rerun the analysis, I think the trend may even change a lot after COVID-19. This literature search was before COVID-19. So this is the picture of how do we define the digital health. But this picture is much better to describe what we have. In the very old days, we just have the mobile and then computer. Around 2000s, we have internet, and then later on we have genetics data and then mobile, social media. All of these we can treat them as health data. Especially nowadays, in the COVID-19, you can see that a lot of people how they use the message to translate the disease of COVID-19. This is also a kind of public health issue. So with this kind of data, we have digital solutions across different devices, including the sensors, mobile connectivities, and social networks, genomics, internet, imaging, etc. Or at the end, we can put on our body. In the fundamental, of course, we hope to prevent the disease, but better diagnosis, how we do the health management, and ultimately, we hope that we can do a lot of things before we have the disease. That is the prevention. So it seems digital health is coming up very important. And we need interdisciplinary language to do this. Therefore, we put hypertension as an example. Why we need to focus on hypertension is because we have a huge database or huge potential patients in this area. Why this is important? Hypertension is closely correlated with an heart attack. In fact, it is a silent killer. Silent killer, that means you may be killed without any symptoms. And the situations of hypertension is a kind of reflections through the blood vessels performance through your blood vessels. The blood vessel inside may have some fatty issue based on the diet, and also maybe we do more exercise, the situation will become better, and then we have no idea because this is inside the blood vessel. Therefore, we need to do blood pressure management regularly. This is important message that we can prevent a lot of cardiovascular disease with this quite traditional way of collecting the data. But you may imagine that measuring the blood pressure, now we have a lot of devices. You may imagine we have a wearables or even some kind of light ECG, put some sensors on the body. But in fact, still under the guideline, measuring the blood pressure, we need to put in this setting. That means we need to use a traditional blood pressure device, put the measurement arm around the heart level. This is important that we can predict the performance of your heart, and hopefully we can prevent a heart attack and also some kind of stroke or other renal diseases. So this is quite traditional, but how we put the digital health on there. Then before I discuss these details, I will come across the cutoff, because we have different cutoff. In Asia, in European, we use the cutoff, the systolic blood pressure still keep at the 140, and the diastolic blood pressure keep at the level of 90 millimeter mercury. But in US, because of the SPRINT study, after that study published, that we do believe that aggressive approach to put on medicines and then we treat the patients with lower blood pressure level still show much more benefits than we put as a standard 140. So we have different standards across the region. But anyway, regular monitoring blood pressure is the first step to understand the status of yourself and how we define whether we are out of the cutoff. That depends on the regions. In Hong Kong, we of course follow the Asian standard. That means if the blood pressure level, systolic blood pressure over 140, and the diastolic blood pressure will be defined as the hypertensive patients. So the normal range should be, the optimal should be around 120, and at the same time, the diastolic blood pressure is around 80. So this is about the cutoff. And how is the situation in Hong Kong? The prevalence of hypertension is like this. In Hong Kong, we have around 7 million of populations. This is a government statistics around 4 years ago. You can see the trend increasing from around 700,000 to now, not now, 2018, we have already over 1 million of subjects that suffering from the hypertension, but this is still increasing. Why? Because this is because in the populations, aging is a crucial factor that we will have more and more hypertensive patients. If your region or like in Hong Kong, the aging population is quite a severe problem in the coming years. So therefore, you can see the age over 65 plus, over 65, the trend is also increasing. But don't be forget the younger old, like age 55 or age 45. We still have 10 to 20% of the cases that they are under the hypertension situations. But unfortunately, I have a bad news to tell you. In Hong Kong, we are quite upset because we have another millions of subjects that they have hypertension, but they don't know. This is based on another survey data around the years in 2018. Based on the checkup, a lot of people that they don't know their blood pressure until the first try of using that kind of machine to see their blood pressure situations. So if in total, combine these two, you can see that we have around 2 million of populations in Hong Kong who are suffering from the hypertension. So what a huge population. We have 7 million, but in fact, 2 million are under these situations. You may connect to an idea that, oh, it seems a big data, 2 million of subjects. Then in Hong Kong, we promote a community e-health project. This is the first step, the trigger point that we need to remove our blood pressure and encourage the participations among the subjects, the elderly. Therefore, we set up this kind of device, not device, this is a kiosk. That kiosk including you can measure your blood pressure, you can measure your body temperature, blood sugar, and some kind of cognitive testing data in the platform. But this is not quite bulky and not quite user-friendly that we can put it at home. So we put it as a community e-health project. Community e-health means that in Hong Kong, we have a lot of NGO. NGO is a community elderly center supported by the government. And then we get some funding from a funding agency and buy this kind of device and put in the community centers. Then the participants will visit the center regularly, and then we will help them to do a well-being survey that we capture the baseline characteristics, including the frailty index, the cognitive functions, and their mood, and also the age, the basic statistics that for this kind of participants. And then we suggest them regularly measure the blood pressure, for example, 3 times per week at least, so that when they come across or just visit the social worker, they will stay in front of this device and collect the blood pressure data. And then we will provide telecare service for those with abnormal BP reading. For example, if they're over 140, we may have a calling service from our nurse to remind them whether you need to take medications or whether if suddenly your blood pressure level has jumped to a very high level, whether we should suggest you to see a doctor immediately. So this is this kind of service model that we connecting the people start aware the blood pressure problems, and at the same time, they are easily to access. And this is a map of Hong Kong. And you can see that we have a lot of center. In each boxes represent an elderly center. We start this project in 2016, and until now, we have over 100 of community centers, and we recruit over 10,000 of subjects. So this project running smooth and quite well. The participation is quite good. And this project, when we review the participants in the first years, because they regularly measure the blood pressure, sometimes we do not have a very clear definitions how we measure, because if we use 140 as a cutoff, And if they regularly measure the blood pressure, for example, in the years, they may have hundreds of blood pressure data. We don't just take a mean of this reading. We just count how many of the reading over the cutoff. For example, we put the patients as a high-risk patients. If the records of high BP records over 50% that they are out of the range, that means if they measure 10 times blood pressure readings, 5 times is over systolic blood pressure over 140 or diastolic blood pressure over 90. If this is the case, we classify them as a high-risk populations. Around 13 minutes of follow-up. They use this kind of digital device with the social workers support, the engagement that they will regularly check their blood pressure, and with the telecare, you can see that the high-risk group dropping from 31% to around 16% after a year. So this is quite good, or a good model that we need to promote the digital device to our elderly populations. Then we have more. This is around 6 years ago. BMJ had already summarized the evidence to show that blood pressure variability is a kind of indicator for the cardiovascular disease and mortality outcomes. This is already proven that if your blood pressure level fluctuates ups and down, your risk will be stronger. This is a very make sense and common sense concept. This is the concept of blood pressure variability we can measure in terms of standard deviations. If you suddenly have some very extreme readings during your daily life, so you can imagine that this is a kind of trigger point that you may have a stroke or even a heart attack suddenly appear around this time point. So if we understand our blood pressure variability level, we need to control, for example, to control our mood, do some exercise, or not quite stressful, because in Hong Kong, sometimes it's quite stressful. So we need to think about how we control our mood to reduce the variability level. This is in fact a real case of our participants. You can see in this diagram. We can even see it shows the seasonal trend. In the summertime, the blood pressure, in fact, will be reduced about a bit, and in the winter time, the blood pressure will be higher in higher values. So this is a seasonal effect. But at the same time, in each one, they will fluctuate along the time and over the years. So we can use this kind of data to classify them whether they are on high variability level. This is we start to apply, for example, using some AI, or we put it as a machine learning technique, because in the old ways, we have no idea how to define the blood pressure variability level, but we have a huge database. We have 10,000 of participants in each one. We have years of data. So we have more data to understand them. We use the machine learning to classify the data. In fact, the machine tells us that we have around 1 out of 7 that they are classified as high variability level. So in this graph, you can see that it seems 1/3, but in fact it is not. If you see the data point, the density of data, more data are here and in the green, the yellow regions, but in red, the density is a little bit lower. So this is about 13% of the overall populations. So in Hong Kong, based on the machine learning techniques, we can define, if we put the 2 extreme case, this is the high variability level, quite extreme. Sometimes the blood pressure can even over 200, but some subjects may just fluctuate around 100 to 140 or even lower. So we have more data, we can understand better our patients, and at the same time, longer times of follow-up, we can see more than enough. And of course, we can apply our AI or even so-called digital health technique to better understand our health profile. So this kiosk has some benefit, because of course it would be a good engagement for the participants, because no one will install this at home. So the elderly, when they come in front of the social workers, they will try to play around this, and then the data will show up in the in front of the social worker. It will help them and also supported by the nursing care that there's a kind of engagement that they enjoy the program. But the drawback is this kind of device, this kind of centers have some limited opening hours. The opening hour is just from morning 10 a.m. to around 6 p.m. So the telecare may be stressful because we have some users tell us that they get lots of reminding call from the nurse, so they quit the study. And at the same time, we are not easily to see the personal report because all data go to the central server, just take care by the nurse and the social worker. And of course, this is very, very expensive. This kind of device around 100,000 of. If in US, I think this is around 10,000 US. And at the same time, we need to offer, for example, Wi-Fi, some kind of data transmitting service or to support this. So seems not sustainable. You may ask whether we can use the Bluetooth device, but in Hong Kong, we are still in the old traditional. A lot of people keeping a blood pressure device without the connections. But unfortunately, we even have the COVID-19 in Hong Kong, but our government quite sharp, the decision is quite sharp to lock down the city. For example, we find some case in an area called Yo Chim Wong. Yo Chim Wong is in the Kowloon area that I think Tsim Sha Tsui, you may know that this is around the area that we suddenly have a lot of cases. So our government locked down the city and at the same time and ask all the residents in this area to have a COVID-19 check-in. So we are quite tight on capturing and measuring the spread of disease, and at the same time, we lock down the city. After the city lockdown, you can imagine that all the service provided from the eHealth program stopped. Then what we can do. The next session I will share about our experience, how we doing something that beyond our service model and even come up with a startup company through the entrepreneur program in the Chinese University of Hong Kong. This is a company that we hope that we put this company name called Deep Health. We hope that deep means that I think you know Google, they have a deep mind using the better AI technique, apply this technique on health. So this company called Deep Health. And Deep Health is a kind of a new concept that we hope to bring interdisciplinary research team and also the subject, the staff with different background to support. This is the place in the Science Park, and then this is in Hong Kong. So we got some funding from the Chinese school, and at the same time, we got some support from the Science Park. So we set up something like this. In the traditional, we measure the blood pressure. We have lots of old adults. They use the pencil and paper format to capture the BP reading. If you go into the details, you find that some data seems missed. And also the morning time, the evening time that they did not write down, is it on 7 p.m. or 10 p.m.? And on the other hand, we have a cloud supported kiosk, but this is very, very expensive. And we don't have spend any budget to buy a Bluetooth device to our elderly because we have a huge populations. Then we suggest this kind of apps, mobile apps like mHealth. This is a kind of device you can scan. I'm not quite sure whether US is fine. You can scan these apps. You can download an app called Health Capture. You can capture the blood pressure device. Just take a photo in front of the blood pressure device. And then we use image recognition technique to recognize the numbers of the reading on the blood pressure machine. And then they will automatically scan the numbers and upload to the cloud. This is a user-friendly and easy task. For example, I download it in my mobile. And then once I register, I have an account. And each time I just take a photo, the time of my submitting the blood pressure image then will be recorded. And this is around the estimate time. This whether I do the blood pressure monitoring in the morning or in the evening. So this is the technique that easy concept, apply some technology through AI or image recognition, and it is user-friendly. Of course, if we are not just putting focus on taking the image, even though we put the perfect technicians to do this kind of image recognitions, but sometimes we have some limitations. For example, the reflect on the lighting, and at the same time, the skill of how to use a mobile and also the blood pressure machine, how we capture the nice photo for the very old subjects may be challenging. But anyway, we provide a lot of training to them. And at the same time, we design a family engagement version. That means that we encourage a couples or a family, they do the blood pressure management together. They can understand the blood pressure situation each other. So this is the idea. We bring up not just a blood pressure measurement technique, we just trying to use the health data to engage the participations and even improve the relationships across the family members. Of course, we got the data. Data can be put in the central portal and create the health reports. Our users find that the health report is useful because they can easily to view the blood pressure data. This is a very simple the data technique, how we present the data in a appropriate, easy understand angle to show in front of the doctor. And at the same time, in the doctor points of view, they have a kind of central portal. They can just click some buttons and see the overview of the patient group. And at the same time, they can call some of the patients if they are on risk of hypertension or uncontrollable level of blood pressure. So this is a different model to service on manage the hypertensions in clinics or even in the NGO, in the community centers. So this is our blueprint. We hope that we have a network. The network not just in the family, and at the same time, you have a network across the family and in the society. And we even invite the nurse, the doctors, and social worker to make this kind of support. This is quite far beyond the digital health, in fact, because digital health is a digital platform. But how we engage the subjects, and at the same time, they don't mind to regularly capture the blood pressure reading and enjoy the sharing with the family members. That is another arch how we use the health data and technology. This is our apps in the past 12 months. Of course, all are under COVID-19. You can see that the key performance statistics show we have already 10,000 users in Hong Kong. And they capture the blood pressure quite regularly done at home, around 500,000 BP records. And also they have the practice to generate the blood pressure reports. This is around 35,000 of report was generated. And in our cohort, we find that we have only 8% they are on risk of hypertension. It seems a little bit low because if some people got hypertension, they have their own way to manage the hypertension or under the instructions by the doctors. But we have this platform. We encourage more community participations outside the patient group. I hope so. And we're still working on the data in this platform, so a more story will come up later. And the accuracy of our image recognition techniques is over 98%. We learn how they capture the picture and improve day by day. So I hope that this platform can join hands between the social worker and health workers with our health reports, and hope that this communication can balance the insufficient manpower of medical doctors in Hong Kong. And of course, engagements, I keep always saying this is very, very important. We also organize not just digital health. In fact, we organize physical meetings with our patients, with our users, and our elderly. We teach them how to use an app to capture this data. And of course, in the right lower corner, this is a kind of artist in Hong Kong, an icon, because we have a kind of interview and they feel good about the blood pressure device. And then we now also promoting this concept in the YouTube channel. So more and more people accept this concept. We use this technique, a kind of digital health technique, to do better patient management. Therefore, after the COVID-19, we have more usage on our apps. And at the same time, in the traditional way, even though the study locked down, we have more cases to use this kind of remote monitoring. So what is the opportunity after COVID-19 with this kind of device? And this is a kind of insight that I can suggest you to think about this. In Hong Kong, we don't have telemedicine before COVID-19. In Hong Kong, we are among the Chinese, we are quite traditional that hope to see the doctors if it is in walking distance. If you have ever been in Hong Kong, you can see that we have a tiny space in a limited housing and a lot of people living so close. So if you find the family doctors, I think the walking distance, you can find one around your housing area. So telemedicine, telehealthcare is uneasy before the COVID-19. But after that, we have some, this is not my company, we have some private companies out there. This is a video consultation service in Hong Kong. Now it is actively promoting service during the COVID-19. So you can imagine that without COVID-19, or even before that, a lot of people speaking the language of digital health, but everyone's thinking that digital health is a platform, collect data, but how we can apply and effectively use, we need to balance. That means if COVID-19 occur, we need to keep distance, then we must lead the remote monitoring. Like we have some partners or some colleagues in UK, after the lockdown, a lot of people, even they want to do the body check after they got the fever, the hospital is full, and then they need to wait at home. It is quite dangerous if we do not have the telehealthcare, we do not have telemedicine. So this is a new model after COVID-19. We need to think about how we use our traditional way of healthcare management translate into the digital health concept. So I hope that the hypertension approach in Hong Kong is a kind of example that to encourage you to think more about this. So this is a virtual platform, a mobile health platform that you can connect your doctors through an apps, and then they will not just for a consultation, but at the same time they will deliver the medications within a few hours. And in our pilot project with the healthcare, because of COVID-19, even though we have a public health a hospital system, that means our patients can go to the government to take the medication service with a very, very low cost, around 10 US dollars. But the problem is in the COVID-19, we don't know the risk of the clinic. We don't know the risk of patients when there are huge waiting area with huge populations or huge density of patients. So we need to think whether we can triage some patients to, for example, if the patient is just a hypertensive subjects, they just, but they do the home monitoring quite nice. They have a regular BP level. Whether we can assign this patient to see to the pharmacy department directly without seeing doctors, because the doctors can see their blood pressure records in their own station without seeing the patients. So we, after the COVID-19, we have this project to encourage the subject, the patients to do the home monitoring blood pressure at home. And then this data can show up in front of the doctor. And the doctor just press some buttons and assign this subject to see the nurse or even direct refer to the pharmacy department, so that we reduce the patient load inside the waiting area. So this is the first case, how we use this kind of home monitoring with digital health technique to reduce the risk of COVID-19 spread. After that, this is a first pilot study. This is sorry that we just put the Chinese name in here because this is a local private doctors network. They have 42 clinics in Hong Kong, and then they will start to use our home monitoring apps in October this year. In the coming September and October this year, we will engage the private doctor to educate them to use this as a kind of service and engage a better engagement for their patients. In fact, the apps fundamentally the basic version is free of charge. We encourage everyone to have regular blood pressure record reading to support and understand their health status. So this concept starts to encourage the participations of the doctors, even the private doctors in Hong Kong. So the network is expanding, so that we do believe that after COVID-19, the engagement, the encouragement using this kind of digital health platform is much more encouraging to the participations. And this is a concept that how we put using a framework from the Canada. In fact, more and more researchers find that your blood pressure reading during the clinic visit is not accurate enough because we do believe that we have the ripple effect. And at the same time, we are not quite sure about when is the best time to take the blood pressure reading. We just suggest at the morning and at the evening time because morning should be more relaxed, and after you wake up, your blood pressure level should be more low, more stable, and that this is a good time. And after the dinners, before the sleep, this is another time that to keep the blood pressure record. So therefore, we suggest the home monitoring, the blood pressure reading should be before after the dinner and just wake up. And more evidence show that we should do out of the office measurements. That means that we do the blood pressure reading not in the clinic. So we have two angles. The first one is the ABPM, that is a 24-hour device wearing the blood pressure machine, and then stay for 24 hours, and then we see the whole profile of a short-term variability in 24 hours. And at the same time, we suggest the home BP monitoring. In here, the cutoff is a little bit lower, not 140. We just take 135 because we do believe that at home should be more relaxed. The cutoff should be lower. So if this is the case that promoting the home monitoring, no matter we have COVID-19, but COVID-19 may be a trigger point that you may be more welcome to do at home. But this is a good timing to suggest remote monitoring and home health monitoring for your health status and regular checkup. They suggest 2 reading evening and morning time for a week, so that, or even double records in each time, so that in a week you got 28 readings. So more data will help your doctors understand better your health situations, so that to avoid the radical hypertensions. So I think this seems a long story, but I think this sharing should highlight us. Now we have more digital health or digital device for our health management. How we should use it. Here are the bring home message. Digital health is an emerging with mobile health, wearable device, or even engagement in social media. Artificial intelligence and big data are the techniques to improve the overall implementations of digital health. Patient engagement, remember, is far more important than just technology development. If we have a very fancy technology, but no one uses it, then we cannot help our patients. So patient engagement, don't forget it. And COVID-19 brings a new but life-threatening challenge to our society. But epidemiological evidence shows that we are required to live with COVID-19 in the coming years. But it brings new opportunity for digital health for sure. For example, the mobile health, the telemedicines, and other AI applications. So if you go this forward directions, and you can imagine that more and more journals come up, so that now we have Lancet Digital Health, PROS Digital Health, BMJ Innovations, and a lot of journals come up to supporting how we use a digital device. And this is the impact factors of Lancet Digital Health is just come up, which is 24 something. So you can imagine that this is quite fast and changing behavior in the community using the digital device. So I can suggest this is the new way to go for our health management. Here are our take-home message. And thank you very much. I hope you enjoy my presentations and hope that it is clear and good enough. And this is a 2 picture from Hong Kong. The upper one is the Chinese University of Hong Kong. If you have a chance to visit that, I can show you around. And the bottom part, of course, our Victoria Harbour. So that welcome you to Hong Kong. Thank you very much.
Once again, we thank you, Dr. Tsoi, for this excellent presentation. And I wonder, is there any members of the audience, faculty, or students have questions for Dr. Tsoi? You can turn on your microphone and speak.
Hello, thank you again, Dr. Tsoi, Kevin. Recently, I was involved in a program called Living Gone. And that program, they send me freely blood tests, like sugar for your sugar. They send unlimited, and the blood pressure machine, and a scale. Whenever I do the measurement every morning and the evening, and it goes directly to them. Is that kind of a system we use in Hong Kong too?
Even in China, we have a lot of this platform, but many people ask, Kelvin, why you need to make an app, a new kind of model that why don't we buy something available in the market? The problem is a lot of devices available in the market, but no one will care about it until you get the disease. If you are a patient with a blood sugar problem or blood pressure, hypertensive situations, you need to see a doctor. And then the doctor instructs you to buy this kind of device and do the monitoring. But in our concept, is doing something before the disease. So, and at the same time, our image recognition technique can capture the data from different types of blood pressure device. So this is a more earlier step to prevent the disease, early engagement of the participants. So this is, I think this is a different level of health management and suggesting to using this kind of device or platform for our younger population. For example, the hypertensive patient can be as young as 40.
Right.
So this is why we do it. And in fact, we in the next step in our startup and also our research team is planning to do this platform can connect to other devices. For example, you buy one, and then we discuss we plan whether the API, the platform interface can cross over, and at the same time, so you can accumulate all the data for other purposes of the health management. So this is a trend that we are planning to do. But in fact, this is not a good research paper, but this is a huge service model.
Yeah, it's nice, very nice, and very educated for me too, because I got started involving in these kind of programs. It's free,
Yeah.
Why not get all the equipment free? So
another way, because it is free, but at the same time, the data will bring up values, including the value for how we do the management. And at the same time, we are thinking that a lot of people come up, for example, the insurance package, because this data is a visualize how good you are. And at the same time, the insurance company or some maybe they suggest you to do better manage yourself, and at the end, the insurance company may have saved the cost. So this is a kind of chemicals between when you have the data.
Yeah, true, because they send messages all the time. Your blood sugar is high, you see your doctor or something like this. Yeah. It's for better management, as you said. Thank you very much. I appreciate it.
Yeah.
Hey, Dr. Tong, welcome.
Thank you. Yeah, really good presentation, Dr. Tsai. And I have a question about the telemedicine. I was wondering, because before the COVID-19, telemedicine, they have really restriction on reimbursement. So when you see a doctor, you have to see a doctor in person, so the doctor can charge you. And for digital and like a video conference, they have most of the insurance company here in the United States, they don't reimburse that kind. I mean, before 19, after COVID-19, because of the pandemic, so they relaxed some of the reimbursement policies. So I was wondering, how is the reimbursement situation for telehealth in Hong Kong? Okay.
I think thank you very much for your questions. This is very tricky because in Hong Kong, I think we are the slowest place that to doing this, because in the old days we just find the doctors easily. But we just the first step to do some, for example, influenza or got some headache, or for example, we need to reorder our hypertensive treatment, that we do the remote interview. But the insurance claim must be, for example, the first time we need to physical visits, and then the follow-up interview, we just a follow-up or just get some medications. This is tricky because I think it is case by case. And at the same time, at least we have our first company to this kind of new things. And at the same time, so I'm quite sure the sick leave certificate is well approved in the community now. Even though you just using a mobile technology to see a doctor, but at the end you can got a physical sick leave certificate. So the world is changing. Or even this is just set up in around the COVID-19 time. This is already 8 years later. maybe they offer a new package with the insurance company. Of course, I think this company is also doing something similar to us. They have the data, how many times they see the doctors. And this data may also be welcomed by the insurance company that they will generate some new product. So this is why we have a startup, why we start the language, not just doing the research. We find that sometimes startup, the incentive is a little bit different. In traditional way we are doing research, we always think that whether we have some cash coupon, the invitations by limited small group of subjects to do the research. But now we have platform, we have digital health, we have cloud management, whether we can build another huge database, and at the end, we can also do a good research with this group of patients. I think insurance company have similar concept, how they do the service or even the business in this new concept of model. So it's I don't have a strict answer at the moment, but I think they are more welcome now.
Thank you.
Well, thank you, Dr. Tong, for your questions. Dr. Tsoi, I do have a questions myself too. So in terms of using such platforms for research, like I believe that the participants who join your programs pretty much it's like a convenience samples of elderly individuals who participate in that. And so maybe you can share with us how you can overcome the challenges of the limitations of a convenience samples of your participants. I see that you do a lot of work expanding the network and expanding the pool of participants. So maybe you can share a little bit more about that.
Wow, this is a challenging. I'm still working on it because at the very beginning, we don't put this as a research cohort, but we are going towards this direction. That means that when the first day we encourage them to download the apps, we don't talk about the patient engagement. They just take the agreement inside an app. We don't capture any personal data, including the ID, the name. We just have a mobile number to connect to the SMS to verify this mobile number is real. We just use as a kind of user ID. So based on the time and the regular use of blood pressure, and then we build the engagement. And then now we have a cohort, but in fact, this is not the research cohort. And if we have a new research design, we will through this platform to send out. And now Chinese students have a kind of research subject that invites subject. They will, if they are eligible, they can participate. You can imagine if we have a cohort, 10,000 or 50,000, and then if we go inside to find 5,000 subjects, it's not that difficult. So this is our mindset. We just build maybe a convenience sampling, but at the same time, at the end, we will do a subsampling with a specific inclusion criteria. Even though we still have some bias because of, for example, the very old people, they don't use the mobile or even the apps, but this is a kind of limitations, but a fast and easy way to have a greater sample size to prove the concept. Challenging, this is the limitations, but I'm not quite sure because I still believe that I'm not proved this record yet, but I still believe that if we have a sample 100,000 and then the age distribution should be random. So I'm waiting for this happen in the future. Maybe a years later, I can do another sharing what happened a years later with our platform.
Well, I'm sure you have been doing excellent jobs with such a large pool of people, and for that, it will be certainly easier to overcome the challenges by doing some subsample as you suggest. And one more thing, I'm very interested, as you mentioned that in addition to your academic responsibility, you create a startup company, and I'm sure you collaborate with computer scientists, engineers, physicians, and many others. So maybe you can spend 2 minutes explaining to us like how this works, because I'm sure many of the colleagues who are listening and also our graduate students who will enter businesses or other healthcare in the future. So how we can learn from your experience, your very successful experience in creating startup and entrepreneurship. Thank you.
Wow, I can spend 2 days to explain this. First of all, if you are academic staff, you can explore whether your school support this kind of entrepreneur program. Because nowadays, like Harvard, a lot of university thinking that encourage the teacher to do these things, trying to translate your knowledge through to the community. But this is very, very challenging. For me, I applied this program and I suddenly find that now I'm doing 3 jobs. One is a traditional researcher, another is a business. I need to understand the client's needs, and at the same time, I need to maybe prepare some YouTube channels and then to encourage the participations. The workload is huge, but I learned a lot of things. First of all, like doing business, the first step, you need to understand your patient's needs or your customers' needs. Why they use the app? Why they don't use the blood pressure, Bluetooth blood pressure device? A lot of people tell us that because I use this app can connect to the service from the Chinese school, and they do believe that our research can help them. So the patient engagement will build up in this channel. Something happened that you cannot expect in the traditional research concept. In the business model, we always start thinking from the patient side, not from your professional angles. So this is what I learned. And a good experience is we do the machine learning to classify the blood pressure variability. But this kind of seems a very, very fantastic research, but at the end, no one private doctor will enjoy this because they don't want to take the risk. They don't know how to explain. But this is the way that the first day they heard these things, but they don't do it. But maybe a few years later, the private doctor may be more welcome. So this is the lecture that we learn in the business model, but not the research side. Research side, sometimes you have a challenging questions or something that new in the market, and then you can collect the data to prove the concept. The business model is more complex. And at the same time, if you do the business model, I can say that I'm not putting this as a business model, because when we are presenting this in front of the investors, always got a comment that, Kelvin, how you can get the money, how you can survive with your team. So this is a tricky question. But originally, I bring the concept from research to bring my research team to doing this. Really slow progress. But one day, we find that we learn a lot of things from different angles. And at the same time, how to plan your business model become sustainable is quite challenging. But this is something new from the research angle. And of course, I think the presentation skills improve because now I can see, for example, today, I try to thinking that I need to present a mixture model of digital health and health management under COVID-19. So this is about the training after I doing the business. So you can see the positive and negative side. So you can hope you can understand, or you can, my sharing can help you to have a better planning for your future.
Well, thank you, Dr. Tsoi, for your excellent sharing. Okay, so maybe I ask one last question. So if there are any students who are currently listening, interested in digital health, especially the type of the category of digital health that you are working on, what would you suggest them to seek out more information about these directions?
Yeah, first of all, no need to pay the money to study all the course online. A lot of digital AI, big data courses are available online. If they cost you money, then forget it. First of all, make some friends with different background. Make some friends with computer science knowledge. Make some friends with social science or even business school. This is some language that you don't know. After that, maybe you can work together with this kind of student to make a small team to fight for some hackathon or some business event. They ask you to give you an idea, you run a business model and run the idea within 24 hours. So this is a kind of good training that how to make open your mind to prepare the future change with digital health and the business model and also the health management.
Well, thank you, Dr. Tsoi, for your excellent presentations and for all the experience that you share with us, both faculty and students here at Georgia Southern University. And so once again, we thank you, Dr. Kelvin Tsoi of the Chinese University of Hong Kong, for his excellent presentations on digital health today. And so thank you once again, everyone, for participating in today's webinars. Okay, thank you.
Thank you. Bye-bye.
Thank you very much. Bye-bye.